Kidneys are paired organs located on both sides of the spine in the posterior wall of the abdomen behind the peritoneum. The right kidney is slightly lower and smaller than the left kidney. Each kidney is approximately 3 cm thick, 6 cm wide, and 11 cm long. The average weight of each kidney in an adult human varies between 115 and 175 grams. Kidneys are bean-shaped organs surrounded by the renal capsule. Perirenal fat and renal fascia also cover and protect the kidneys. On the medial side of each kidney is the renal hilum. This part is where the renal artery enters and the renal vein and ureter exit. Kidneys consist of two main parts, cortex and medulla. The main unit of the medulla is the renal pyramid. There are approximately 8 to 18 pyramids in each kidney. Projections of the cortex called renal columns are between the renal pyramids. The apex of each pyramid goes towards the renal sinus. This part is called renal papilla and opens into a minor calyx. Several minor calyces form a major calyx. The major calyces join together and form the renal pelvis where the ureter leaves the kidney. The functional units of the kidneys are called nephrons, which filter blood and produce urine. There are approximately 1 million nephrons in each kidney. Each nephron consists of two main parts, corpuscle and tubule. The renal corpuscle is the nephron's first filtering part located in the cortex. The renal tubule continues this part and goes from the cortex to the pyramids. The renal corpuscle consists of a bundle of glomerular capillaries called the glomerulus, which is located inside the glomerular capsule called Bowman's capsule. The proximal tubule leaves this structure and forms several coils. The next segment that goes to the medulla is called the loop of Henle, which consists of a thin descending limb, a thin ascending limb, and a thick ascending limb. Next to this part is the distal convoluted tubule. The part of the nephron where the afferent arteriole and the distal convoluted tubule come together is called the juxtaglomerular apparatus. The area that connects the end of the thick ascending limb to the beginning of the distal convoluted tubule is called the macula densa. This part is in very close contact with the vascular pole of the glomerulus. Next to the distal tubule is the connecting tubule. Several connecting tubules from adjacent nephrons join together to form cortical collecting tubules. These are also connected and form cortical collecting ducts. Cortical collecting ducts enter the medulla and form the outer and inner medullary collecting ducts. Medullary collecting ducts join together and form papillary ducts near the apex of renal pyramids. The papillary ducts leave the pyramids and their contents go to the calyces and then into the ureter as urine. There are two main types of nephrons, cortical nephrons and juxtamedullary nephrons. The glomerulus of cortical nephrons is near the outer part of the cortex and has a short loop of Henle, while the glomerulus of juxtamedullary nephrons is deep in the cortex near the medulla and has a long loop of Henle. Kidneys are supplied with blood by renal arteries, which are a direct branch of the abdominal aorta. The renal artery enters from the renal hilum and branches into segmental arteries, interlobar arteries, arcuate arteries, and interlobular arteries, which supply blood to the afferent arteriole and then into the glomerulus. Glomerular capillaries join together and form the efferent arteriole that carries blood to the peritubular capillaries or vasa recta. Then the blood flows to the venules, interlobular veins, arcuate veins, enter lower veins, and finally to the renal vein and leaves the kidney.